When people hear all-on-4 dental implants, they often think about teeth in 1 to 3 days. And in our clinic, that's exactly what we aim for, giving patients their fixed teeth immediately within 3 days after their surgery. Hi, I'm Dr. Wilfred Koon, Principal Dentist here at The Point Dental in Melbourne, Australia. But here's the thing, getting to that point is actually not as simple as it sounds. In fact, there's one challenge that makes all the difference between being able to give you your fixed teeth right away or making you wait for months. And today, I want to share exactly what that challenge is and how we have learned to overcome it in almost 100% of our cases. The goal and the challenge. When people come to us for all-on-4, they are often hoping to have their new teeth within just a few days of surgery. And in most cases, we can make that happen. But for that to work, the new teeth need to be fixed onto something that's strong and stable from the very beginning. So imagine building a deck. You can't put the boards on unless the posts are firmly set to the ground. Or if you're going to hang a heavy shelf onto the wall, it has to be attached into solid studs and not just the plasterboard. So in dentistry, that solid foundation is the bone in your jaw. And here's where it gets tricky. Every patient's bone is different. Some have very strong bone and some have very soft bone. That's why for us, making sure that the foundation is rock solid is the single most important part of the entire all-on-4 process. Why it's a challenge? So the challenge is that the bone quality is not something that you can completely predict just from taking a 3D scan. When we take a scan, we get a good idea how the bone quality is, but it's only when we're actually in the surgery that we truly know what we're working with. Softer bone means it's harder to secure the implants straight away. And if the implants are not firmly attached to the bone, putting teeth on top of them too soon can jeopardize the whole treatment. And the reality is, in some clinics, I've been told that as many as half of their all-on-4 patients have to wear dentures for at least 3 to 6 months before getting their fixed teeth. And for a patient who has been dreaming of their new teeth, that can be a huge disappointment. How we achieve almost 100% success. In our clinic, almost all of our patients get their fixed bridge within days of surgery. And that's because we are not relying on just one method. We combine 5 key things that all work together. First is the planning. We start with a very detailed 3D scan to see exactly where your strongest bone is. And we plan the position and the angle of every implant down to the millimeter so that we are aiming for the best possible support. Second is the technique. We adjust how we prepare the bone based on what we find. So in softer areas, we create a slightly smaller opening so that the implant compresses the bone for a tighter fit. And if necessary, we change the angle or use a longer implants to get more grip. Third, advanced surgical skills. If the jawbone alone is not strong enough to support the implant, we are also well trained to place the implants in other parts of the face that have much denser bone. So this includes zygomatic implants in the cheekbone, pterygoid implants further back in the mouth, and transinus, transnasal or piriform implants around the nose. This means that even in very challenging cases, we can still find strong anchor points for your implants, and our results are not just limited by our skills. Number 4, the right implants. We use Nobel Biocare implants, the original implants for all-on-4 treatment. They are designed specifically for people with soft bone with a very high success rate. So instead of just cutting into the bone like most other dental implants in the market, they actually compress and strengthen the bone as they go in, which is exactly what we want for softer bone. And because Nobel Biocare has the largest range of implant sizes, we can choose exactly what each case needs, and we are never limited by the tools, and we can adapt to any bone condition in your jaw. Number 5, experience. After thousands of implant cases, eventually you develop a feel for exactly how to get that secure foundation. Every drill, every vibration, every bit of resistance we can feel on the bone, and every adjustment or choice we make is backed up by years of doing this successfully, including in some of the most challenging situations. The rare exceptions. Now, despite our best planning, best tools and experience, every year we still see 1 or 2 patients who will have bone that's simply too soft for us to put the teeth straight away. One patient I will never forget. Her name was Debbie. Very lovely patient. However, her bone was so soft that I didn't even need to use a drill. I could literally push through her bone with a blunt probe, and it was like pressing into a sponge. Fortunately, we knew from her CT scan that this could be a possibility. So before the surgery, I had already discussed this with Debbie, and I explained that if we found the bone to be too soft, we have 2 options. First, is we can place zygomatic implants into the cheekbone for a stronger anchorage. Or we can use a temporary denture and wait for a few months for the bone to heal before attaching the bridge. And she told me she was happy to wear a denture for a short time. So that's exactly what we did. So 6 months later, we attached her bridge. And today, more than 9 years later, her implants are still rock solid and she couldn't be happier. Sometimes we just need some patience and let the body do its magic. Takeaway for patients. At The Point Dental, our goal here is always to give patients their fixed teeth as quickly as possible. And with the right planning, skills and experience, we can do that in almost 100% of cases. But for me, it's never about being the fastest or trying to complete a surgery in record time. What matters most is doing the very best surgery for every single patient, every single time. I want to know that when I go to sleep at night, I can rest easy knowing that I've made the safest and most ethical decision for each person who has trusted me with their smile. And because at the end of the day, long-term success will always matter more than the speed. So thank you for watching, and if you want more honest conversation about your dental implants, don't forget to like this video and subscribe to our YouTube channel and follow our Facebook and Instagram page. So see you in the next one.